You just stand just normally, because all I'm doing is I'm just talking.
Can you see this from like up here or like?
Yeah, like from here.
Oh, okay, so I can put my hands in my pocket now.
Yeah, you can put your hands in your pocket and just look awkward. Okay, cool. I'm just kidding. All right. Hey everyone. Oh, okay, ready?
Wait.
Hey everyone, this is Dr. Alex Tubio. Welcome back to my channel. Before we get started, if you could please like, comment, and subscribe, I would really appreciate it. Today we are here with Saira. Go ahead and wave. We're gonna go through an adjustment. I'm gonna show you your x-rays and then we'll get started, all right? So let's get started. All right, so Saira here is one of my patients. Actually, she's about to go to chiro school here. So awesome
like
for that.
Week.
Yeah, like next week. So she's, I think I saw a snap of or your Instagram story where your car was being loaded. So that's so cool.
Yeah.
But anyway, she first came in here. Actually, no, I'm gonna let her tell you guys what she came in here with first.
All right, so first and foremost, I didn't even come here for myself. I came in here for my grandma. Because she was having some issues, so I came in, we got her x-rays done and everything like that, and then I was like, okay, well, why not I just come here? Because I had a lot of digestion issues. I went to a lot of doctors. They didn't really give me any answers whatsoever. My cycles were missing for 2 years. I was losing a ton of weight, so pretty much a bunch of stuff was going on, and I didn't know exactly what was going on, and no doctor was telling me anything. They just wanted to, give me pills for this, give me pills for that. So yeah, it was pretty much horrible for like 2 years. So I came here and I was like, okay, well, let me just give this a shot. And after coming here for a couple of months, literally, I want to say like all of my symptoms have disappeared.
That's awesome.
So yeah, it's been amazing, honestly.
So that's one of the things that I always like to convey to people, that whenever you talk about chiropractic, especially chiropractic care where it is corrective, that it's more than just about pops and cracks and pains and all that type of stuff.
Yeah, like, sorry, I don't know. Go ahead. Before this, like, I've never experienced any type of back pain, no neck pain, shoulder pain, anything like that, like whatsoever. So that's something that I like to stress to my friends and to like just everybody that I know. It's not about you having back issues. Like, I mean, as far as pain goes, it's much more than that. Because I mean, I didn't come here for pain. I didn't come here for me, and it completely changed my life. So.
Yeah, so that's something that I really try to convey to a lot of the patients, that it's more than just about pain. Chiropractic can have a huge impact in your life, not only just physically, but also mentally, and all with the other rest of your organs and system. I have people that come in here that have fibromyalgia, and I'm not ever saying that chiropractic cures fibromyalgia. I'm just saying that what we actually do as chiropractors is make your nervous system work a lot better than it was before. And that's really the main goal of what an adjustment is. Whenever I adjust her or Ken, who's behind the camera right now, whatever it is, I'm just trying to make them try and have their body functioning better than it was before. All right?
And one last thing. One thing that was major for me was that I would get anxiety every single day. Every single day I would have a nervous stomach, and it would prevent me from eating, how I should eat. So obviously I was losing a ton of weight. And so after coming here, my anxiety completely went away. Like, I have not experienced, anxiety ever since I started coming here. So that's another thing as well. So not only did it fix my digestion, my hormones and all of that, but it also fixed, my anxiety. And that's a huge thing for me, so.
That's so cool.
Yeah.
All right, so what we're gonna do now, well, obviously I was gonna ask her how she was feeling after treatment, but since she already kind of got into it, obviously now everything's kind of relieved. But what I want to do is really go through the x-rays, show you exactly what we're going to adjust on her before we actually do adjust her, and then go through an adjustment. All right, so let's get started. So this is Saira's before x-rays. Now, one of the biggest things whenever I'm looking at her before x-rays is that her head is really far forward this way. You can see that this head is really almost looking down a little bit more. Whenever I'm measuring her forward head posture, this 26.2 millimeters should really be 0. But right here, it is forward. You can see that curve that's supposed to be a 43-degree curve is actually a 30. All right, so right here, if you look at this blue curve right over here, I just redrew it, but this is where that curve was supposed to be over here, but you can see that it's really far forward this way. Whenever you have a lot of forward head posture, it could be because of how you're sitting, the phone, especially nowadays, even just through school, a lot of times you're just always looking down. So what we had to do was really pull this curve back the opposite way. Also, what ends up happening is that people that start to lose that curve, and you know, it doesn't stop right over here. It's at a 33 out of 43, but people come in and they have 0 out of 43, and sometimes it goes into the negative portions. And when it starts to go into negative portions, I see a lot of people that come in with headaches, migraines, neck pain, shoulder stiffness, even mid-back pain. Everything is really related to how this curvature of your neck is set up. That's why a lot of people say posture is so important, and it really is, because you know, I want to take that a step further where your actual structure is really important. So right in through here, so this is the before, we look to the afterwards. Now after, that curve is a lot more back further where it needs to be. That forward head posture, instead of registering at a 26, is now a 10. That curve is now a 45 out of 43, and that atlas is now a 29 out of 31, where before that atlas was a 23. I don't think I touched on the atlas before. So the next portion that I'm going to show you is this lower back portion. This is the lower back portion right over here. This is the right side when you're looking at from the back. So this is your right side, your left side. This right side on over here is an 8.2 millimeter. So this right side is further down. Whenever we look at this new one, this right side's still a little down, but it's not as much. It's at a 6.3 millimeters. So we've been able to take this pelvis and actually pull it back up over there. So whenever I adjust her, I'm going to adjust this portion right here, this right side, really push it back up, get all of these joints moving again. This is pretty good, especially since it's going just straight up and down. And then whenever we're looking at her atlas, it's going off a little bit to this right side, so I'm going to contact on that left side of that atlas and really pull it back the opposite way over here. The rest of her spine is really good. It's straight up and down. That's exactly what you want to see. You don't want it to have any deviations or curves, and I see that a lot through here. So we're gonna get her adjusted now. All right, ready? Cool. All right, so if you haven't been tuning into my channel, this is a drop table. This allows me to really pop up and pop down. The only reason why I do it this way is that way whenever I do adjust her on some of her sides or her back, it's not as aggressive, especially when somebody is really overweight and I can't push down as hard. This really helps me really get the adjustments that I need. Okay, so I'm gonna have you go face down here. Whenever we were looking at her x-rays, this right side right over here, this hip was a lot shorter than this left hip, or this right hip was shorter than this left hip. So I'm gonna adjust this portion here first. But what I like to do is really see what the muscle tone is like, how everything's being affected. So I'm going to start with this hip right here first. And then all I'm going to do is I'm pushing down from P to A, which is posterior this way, and then anterior this way, and I'm going to actually push upwards just like that. We'll do one more time right here. Deep breath in, exhale out. Now I'm going to be taking this and pulling. Good. And then one more time and exhale out. All right, so now I'm going to be adjusting her mid-back region. Sometimes the cavitations or the pops don't really go on her stomach, but that's okay. If anything, we'll get in the other side here. Look up a little bit for me. Now I'm going to have you on your back. So I'm going to have you bend your knees here for me, just like that. Come a little bit closer. You're going to try and listen for this here. Try to come a little bit more this way. There you go. Good. Take a deep breath in. Exhale all the way out. And you can go right here. Good. Good. And then I'm going to actually have you now face that way on your side. So whenever with digestive issues, a lot of the times, a lot of these nerves that are going through this lower back that go to the intestines, that go to the digestive system right there, can be affected So whenever she was coming in with digestive issues through here, I would make sure that I adjusted her low back, and it seemed to honestly work.
Yeah,
So,
for sure. 100%.
yeah, so we're gonna adjust her low back just to keep it regular through here. I'm gonna bring this right here. So I'm gonna take your arm right here, right there. Just gonna hold right in through here. Right here. I wanna, there you go. Take a deep breath in. Exhale all the way out. I'm going to push this right here. I'm contacting this right SI joint. Good. Go on the opposite side. Then take this one from this one. Good. We're going to go just like this. It's the beauty of video. That was good.
Yeah.
All right. So I'm going to be doing occipital lift on her cervical region through here. Also getting her atlas as well too. So I'm going to have you sit up for me. I'm going to face that way. Take off your earrings here for me. So I'm going to be contacting right here. Good. All right. So I'm going to be coming up. Just like that. And exhale, relax those shoulders. Good. Awesome.
Oh, so I can't get over that. That's
Good.
crazy. Okay.
Alright, so then we're going to go on the opposite side right here. Good. Yeah, and turn this way. Good. And then roll your head. Take a deep breath in, roll back. Exhale, good, right here. Good. That was even better than
That's
before.
crazy. Yeah, that's crazy. Wow.
All right. Good. So let me recheck you. I'm going to have you go face down.
Okay.
Cool. So whenever we look at her feet now, they're a lot more even through here. How do you feel? Yeah, that feels way better. All right,
Yeah.
you are all set.
Cool.
All right, so that's pretty much it. I just wanted to go through an adjustment, show a patient spotlight right through here. If you guys have any questions, feel free to message me on Facebook or Instagram, and make sure you comment, like, and subscribe to this video if you like it. All right, until next time, guys, please, like I said before, please make sure you like, comment, and subscribe. I really appreciate it. All right, bye. Cool.